Good morning, everyone, and welcome to our World PI Week kickoff webinar. I'm really excited to begin this webinar and start our week off for World PI Week, talking about the World PI Week theme this year, which is ensuring access to treatment. So I'd like to start today with a little land acknowledgement. Today, CIPO is we work, and I find myself today on the traditional and unceded territories of the Lekwungen-speaking people that's here in Victoria. And we are also have historical relationships with the Songhees, Esquimalt people. And I don't know where you find yourself today, but if we could just take a second to recognize where you are, that would be wonderful. So today we're using Zoom. So if you have a question for our panelists, you can use the chat function. You can use the Q&A or you can raise your hand. We will have, our presenters will each be speaking, and then we will have a Q&A session at the end. So there will be time for questions. We will be monitoring the questions as well. So we can save your questions. So make sure you can ask your questions. You don't have to keep them to the end. And then at the end, we will be answering all questions. If you have any technical difficulties, if you can't hear, if you can't see the slides, Lauren's here with us today, so you can direct message the CIPO office and we'll help you out. So our guest today, I'm super excited to have with us Martine Pergent and Adrian Goretzki. Martine is the current president of our International Patient Organization for PI, IPOPI. She was elected in 2018 as president after serving 8 years as vice president on the board. In 1998, Martine co-founded IRIS, which is the French patient organization for primary immunodeficiency. And after 10 years with IRIS, she was named an honorary member for her contribution there. She is still an active board member with IRIS today and supports IRIS and their executive in that way. Martine believes with her advocacy work that patients should not only be heard, but also listened to when it comes to their decisions and decisions being made about their health and treatment, which we also agree with, and that's what we're working for as well. So thank you for joining us, Martine, today.
Yeah, thank you for inviting me.
And Adrian Goretzki is the former leader of the Polish patient organization for primary immunodeficiency, Immunoprotect. He was also on the IPOPI board as well. And for his successful contribution, Adrian was given the Luciano Vassalli Award in 2014. He is also the recipient of the University of Silesia's Rector's Award in 2020. And last year, he was shortlisted for the Eurordis Award for patient advocacy, which is really amazing. So we're happy to have him here. He, in 2017, founded the Healthcare Education Institute, which is who he's representing here today. Adrian is a patient himself and brings a unique voice to the conversation today. So thank you, Adrian, for joining us.
Thank you for this introduction. I'm very happy to be here.
So I'm gonna stop sharing and I'm gonna hand it over to our wonderful panelists. So I'm gonna start with Martine.
Thank you, Whitney. And I am sharing my screen. I guess you can see it. Okay. So the subject is about ensuring access to treatment. And there, I'd like first to have some introduction about IPOPI in the case you wouldn't know us. IPOPI is the Association of National Patient Organization dedicated to improving awareness, access to early diagnosis and access to care. And this is for patients living with a primary immunodeficiency worldwide. In that perspective, you can see this nice group and someone here that you may know. At a glance, I just would like to highlight the fact that we have a very committed, diverse board coming from all the continents, a committed and diverse medical advisory panel, a committed and growing staff, a growing membership, and a united community. And I think this is a big strength of our community to be united and to promote cooperation. As per the membership, we currently have 69 countries, last being Israel. And you can see that we pretty well cover the world, despite the fact that Africa is still, in Africa, we still have a lot of country missing, but we are working hard on that. So to make people aware on the fact of the fact that this is very important to be in a patient group as per access, because this is the theme of this meeting. Today is the day where we launch the World PI Week. World PI Week is a momentum for our community. What part do we take as IPOPI? We are one of the members of this consortium, and you can see that this consortium is made of a lot of organizations covering all the continents, Asia Pacific, Africa, Arabic countries. This is CIS, you well know, European again. Here, this is the only national body. I think it's part of history. The nurses, of course, the patient groups, the Jeffrey Model Foundation, the Latin American group, the industry here, and CIPO for Southeast Asia. So we are a large consortium, and all together we work to in order to define a yearly campaign. And here, as you already have shown us, Whitney, we have the 2022 campaign, where we state that lives can be saved and that access to healthcare is a basic human right. And I think this is really important to state this again and again, especially given the fact that many patients, mostly in the world, are not diagnosed at all. So besides this, IPOPI has its specific contribution to World PI Week. We support local implementation of World PI Week through our grant program, and we support, for example, this year we will support 28 national projects. We also disseminate information about the World PI Week material. We promote World PI Week through our social medias, of course, and as a result, since the inception of the campaign, IPOPI supported 170 plus NMO, which stands for National Member Organizations, national campaign. I just would like to give you a flavor. Yes, among our activities, I would like to highlight the IPOPI campaign, which is called this year, My Physician and I, where we ask our members to just have this selfie with one physician, with their physician, to highlight the importance of the link between a patient and a physician. And you can see here, maybe you can recognize him because with the mask it's not so easy, a patient with Alain Fischer from France, and just having this selfie with his patient. So we hope that you Canadian people, you will have a lot of selfie to put on the social media that we would be able to share. And I hope that every country will do the same. And we already can see that on the social networks. I just would like to give a flavor, a very quick one. Of course, there is a lot to read, but don't be afraid of that. I won't go into that. But just to see, to show you what the different kind of initiatives that we can face and have throughout the world during this World PI Week. And for example, here we have China, but you can see that Hungary, for example, does a lot of very nice things as well. And we can see also that the initiatives are very diverse. It goes to education, but also to events, to a lot of things, drawings, for example, contests, a lot of different things. Here is Kenya, where they just state about the fact that rare diseases is something that we need to know about. Because in many countries in the world, including maybe Kenya, but not only, having a rare disease is subject to stigma. And this is something that they want to address. Here we have Malaysia, and they are also very active in the very different manners. Poland, I wanted to have a word on Poland, where they provided last year masks to their community, and I think it was really appropriate given the very tough period we have due to COVID-19. Sudan, which is a very poor country, and they have a lot of problem in diagnosis, and even more when they have diagnosed to access to care and to treatment, especially immunoglobulins. And but they have a group now, and they really do everything they can to raise awareness and to make their health authority aware of their situation. I'd like also to address another poor country. It's not a poor country indeed. It's a country where people get poor because of their policies, their politicians, and but Venezuela is also very, very active. So the subject is access to care, and as World PID Week states, this is a basic human right. And when we speak about access, of course, we think of diagnosis. Access to diagnosis is a very primary thing that we have to consider. But when it goes to diagnosis, then we have to consider screening, and especially newborn screening, data, collecting data, but also the knowledge when it comes to laboratory knowledge, and also facilities. In many countries, they just don't have facilities to make diagnosis. And of course, we also face medical awareness and knowledge. On the other hand, we have, of course, access to treatment. This begins with diagnosis, but then we have to move to treatment. And this goes to access to treatment with a marketing authorization, because when a treatment exists, and we are pretty lucky in this field, because many of our conditions have treatment, but is it marketed in a country? This is another question. When it is marketed, is it affordable? This is another question. Is it available? This is another question again. And we know about immunoglobulins, for example, that it's not a question always of being a developed countries, and that we in many countries struggle to have a continuous supply with this condition. Of course, we need immunologists, and not every country has some. We need facilities, and I'm thinking especially for transplant, and not every country has. Healthcare professional in addition to immunologists, because this is not only about a physician, this is also about nursing, or about a physiotherapist or other kind of specialties, and also other organ specialists who need to be aware of PIDs, a lung specialist, for example, but many more. So this all figures out a healthcare environment, and at IPOPI, we have thought that maybe that would be interesting to release some kind of tool that would describe it, so to allow our NMOs, our members, to advocate on this, being aware of the situation in the country compared to other countries. From all of this, of course, we have a strategic plan, but continuing on what I was exactly saying about the data that we could have and the environment in the country, we have worked on defining 6 principles for care for PIDs, and I'm speaking there of golden standards, which we have translated into key principles. And here you can see, first of all, we have diagnosis, then treatment. We've introduced this one. This is universal coverage, because in many countries, this is not a given that you have access to the treatment, even if it is available in the country. For example, some country you can access it when you are a child, but not when you get adult, or you can access it when you work for the army, or if you are a civil servant, or there are that kind of condition that makes that not everybody can access to that. Of course, we need specialized centers where we have people skilled on PIDs. We need national patient organizations who are very skilled, and we support them in that for advocating, so to allow access together with the physicians. And we need data, registries, we need epidemiology, and this is the 6 principles of care, which we have translated into criteria. If I just give the example of the PID diagnosis, we have the diagnosis rate in the country. This is pretty interesting to consider given a theoretical rate. A biological diagnosis is available, genetic, prenatal, newborn screening. And then we have for every of those principles define that kind of criteria. And out of that, we have built an index, which we call the PID Life Index, based on 100%. And it is aimed at measuring the status of the PID healthcare environment in a dedicated country. So with that, we have to gather the data through a questionnaire, then have a database, and then we wanted to have this PID Life Index released out of a data visualization plus a map interface on the web so that everybody can be aware of the situation. And here you have a picture of the global environment for PIDs. You can see that Canada is pretty well because you are in the best quartile, if I may say so. But you can see that, first of all, we have a lot of gray parts, meaning that we have no data there. And of course, we have lighter blue, which means that the score is less important than in the best quartile. We have also translated that. Here you find the 6 principles again. So this is the global score of Canada, for example, 67 out of 100%. This is really good. And you can see here, given the different principle, where you have something that is less than expected, if I can say so. And this is something that we can, thanks to this interface, enter into detail and go deep digging into detail. So access to care, what is IPOPI doing in addition to just release what we know about the environment in every country? In fact, we work on several fronts. And if I even dare to say in more and more fronts. First, advocating is very important, and advocacy, this is something that is really a skill that our patient group have more and more. And at IPOPI, we want them to have this because this is where the patient group can really make the difference in their country. And as Adrian is there, I know that thanks to the advocacy of his patient organization, for example, they have had access to subcutaneous in the country, which is a great achievement. But this is just an example, but there are so many and so specific also a reason for advocating in each country. So we advocate at European level, especially because in Europe, this is important to try to have directives that will push, let's say, or support the different country to go into the best way possible for rare diseases. But we just not keep in Europe, we also address, for example, here with my colleague Bruce Lim from Malaysia, board member of IPOPI, the Asia Pacific Economic Cooperation, so to raise awareness on the fact that we need to collect blood at first and plasma even better. And also the United Nations, we have some advocacy there. We want to always have the PIDs at the European agenda, because also we know that the 26 countries in Europe look at that, but not only there, as you well know, North America and Europe are kind of the place in the world where the other country takes some, not model, but at least examples. So this is very important to work at this level. So we have forums where we try to have members of parliament who will support our theme, our topics, our asks. And there we just have the theme that is the most relevant from the policy actuality, let's say. So the next one we'll have is on antimicrobial resistance, multi-resistance, because many of our patients are on prophylaxis with antibiotics, for example, or on demand. And this is very important to push our countries and Europe especially to launch research on alternatives for those antibiotics, where we know that maybe they will less and less protect, and we know that this will be a big burden in the coming years. Of course, we focus on plasma. More than 50% of our patients rely on IG therapy. And we know that the world is struggling because of the supply. Of course, we struggle because of the lack of plasma collection. We know that for long. And of course, COVID-19 has highlighted this in a very strong way because of the drop in collection. But this problem exists for long. And at the moment, we just try to make people understand, especially because at the European Commission, the legislation on blood, tissues, and cell is under revision, and this is a momentum to let people, the decision maker, hear from the patient voice. And this is not always easy because there are some other stakeholders who maybe won't say the same and maybe won't take the patient interests at heart. And this is how it goes. So we have to really raise our voice very strongly. Another topic where we want to address is the newborn screening activities. Newborn screening for kids has proven being very efficient in many countries. I know that Canada is really good on that. I think that you have almost all your provinces proceeding with this, which is great. And but this is not the case all over the world, especially, for example, in my own country, in France, we just don't have this so far, which I can't understand, to be honest, but this is the case. And there we have a group under the brand Screen for Rare, where we are, as IPOPI, we have the experts with us, experts meaning the International Screening, Neonatal Screening Society, and of course the ACID as for the physicians. And there we try to not push country to have this, but to push Europe to support their countries to launch that kind of problem by gathering experience, gathering data, well, support them. So this is the most easy as possible, because we don't believe that we should test for everything or screen for everything, but at least improve the way of screening, ensure that screening is not a one shot and that there is a solution after that. Because if you screen, if you find, but you are not able to treat, this is not the best way. So for that, we have created together as partner the International Neonatal Screening Day, and we will celebrate on June 28th. We also work in advancing clinical care. We know that in many countries there is a lack of immunologists. We need that young doctors get interested in PIDs and moreover in immunology. And we also want that there are places where we don't just address research, but also the way research will go to the patient situation. And this is the role of EPIC, and this will be next week. So we are very busy at the moment, but we also have a lot of webinars, as you can see here, and we work also with the forums and other things like this. We more and more are committed in research, and I know that this is also the case for some NMOs, for some members, and I would push you as a national member to also commit in research. This is the place for patients to partner in research programs, because there we can provide patient input in research and in the development process. We can also optimize patient involvement and also the communications. And also, as I said, we can support with health policy and regulatory expertise. And for example, in Europe, we also are part of the European Research Network, RITA. RITA stands for all the immunological disorders far beyond PIDs. At the moment, the following consortia have approached IPOPI to seek active collaboration. So you see in many fronts, we are asked to take part, and this is really very nice because this is important that there as well, and as early as possible, the voice of patient is heard and taken into account. Of course, we raise awareness, and we do that through mainly meetings at national level, especially to launch, for example, new patient groups, as you can see in different parts of the world, but also at regional level. We had one in Southeast Asia. We will have at the end of this year another one in Southeast Asia. And there we want to support our patients so they get skilled, so they are able to advocate. And also we provide them with a lot of material, like for example, those leaflets. You can see an example on the right-hand side of the screen. Now, and as a conclusion, I hope I am not too long, I just would like to speak about the evolving landscape. We have to think also on the future and what the future will say about IPOPI and about the PIDs and about the PIDs in every country. At the moment, when we began some years ago, more than years, we spoke about 130 conditions. Now we are above 460. Where will we be in 10 years? And we can assume that maybe we will reach 1,000. We are not sure because it depends on the genes, but well, it's quite possible. We can see also more and more crossovers with autoimmunity, with autoinflammation, with allergy, with secondary immunodeficiency, with cancer. And this is very important to work together to consider those things. We, of course, need to improving knowledge and diagnosis rates with genetic screening, with newborn screening, and we still face a major underdiagnosis. We estimate that 80% of the population worldwide is not diagnosed at the moment. Another thing that is a very big challenge is access, and especially when it comes to pricing, especially with innovative medicines. We can see, for example, with gene therapy, that the price are rising very high, and of course many countries are afraid about reimbursing such amount of money. So this is something that we will need to address and to prove the right balance between pricing and reimbursement, and between sick people and healthy people. Transition care between childhood and adult is also a big issue in many countries. Advanced therapy are developed more and more, and but we still can't see any foreseeable alternative to immunoglobulins, and this is something that we need to state because this is a big difference, for example, with our friends from hemophilia. The plasma field is very changing and very quickly, and at the moment IG demand seems to continue driving the plasma field, and this is a very important issue and also a very important responsibility we have as immunoglobulin users. We need for more regionally balanced plasma collection to attain global sufficiency. We don't want to speak about a national sufficiency when it comes to plasma and immunoglobulins because it doesn't make sense. But we know that we can't keep on relying on the US. We need to expand newborn screening, and at the moment I'm very happy to say that we will have a first pilot in Malaysia, so far from Europe, or from the United States, or from Canada. And of course, we have to take lessons from COVID-19 because we are not sure that we won't have to face another pandemic in some times. The way forward for IPOPI is to be committed to further increase the activities at the key international advocacy organization on behalf of the PID patient worldwide. And of course, we value very much collaboration with the stakeholders. And we need also to seize the many opportunities that present themselves to us and work together to overcome those challenges and to define our way forward. I know that Adrian will address this subject, but I would like also to say that Ukraine is in our hearts. IPOPI and his partner are working hard to support care, treatment, and accommodation for refugees. And I want to highlight this just to say thank you to Canada, because I know, thanks to the work of CIPO, that you have made everything possible to be in the position to welcome refugees. And for that, I would like to thank you. Thank you very much for your attention and for inviting me once again.
Thank you so much, Martine. Adrian, I'm going to pass it over to you now.
So thank you for inviting me. Thank you also. I mean, I was happy to see the presentation of the IPOPI, as this organization will have a special place in my heart forever. And what I would like to address today to you is a little bit about the special circumstances that we are here in Europe right now. Well, I just also remember that I met your executive, I mean the executive of CIPO, in the special circumstances, because I met Whitney in Barcelona, one of the congresses, and we were meant to be on a dinner, but we missed the bus, which was organized to bring attendees on the dinner, and we were chasing this bus in a taxi. And I remember probably Whitney was trying to communicate with the taxi driver in Spanish. So this was a journey, and this is how I met the representatives of CIPO. But those circumstances that we are here and now are totally different. I wish to have more stories like this from Barcelona rather than to deal with the situation that we have right now. So let me just share my screen, my presentation, to show you what is the situation. So it's being shared. Let's start with the presentation. So this presentation is about Ukraine, about the current situation in Ukraine. As Whitney said, I was a president of the Polish patient organization for 10 years, and I am patient myself, a patient with X-linked agammaglobulinemia. And I'm a lawyer by profession, lawyer specialized in medicines reimbursement. And but I stepped down from being the leader of the Polish patient organization, and I started my own nonprofit in 2017, taking care of rare diseases, taking care of scientific and legal affairs regarding rare diseases, also in training other patient advocates from many various therapeutic fields which are in rare diseases. But as the Russian invasions started, as there is a problem with providing care to Ukrainian patients with PAD, I decided to be back in the business as long as would be needed. And we are currently helping those people as a foundation. I mean, our nonprofit stopped the usual work and focused on helping those people. There is the first slide. You can see a photo of Yehor. This is one of the first patients that we moved from Ukraine to Poland and provided him with immediate access to immunoglobulins, as you can see on the photo. When it comes about the situation, just let me explain that this is a humanitarian disaster that we're facing right now in Europe, that we're facing mostly in Poland, because most of the war refugees are in Poland because of many aspects. I mean, most important ones are the the fact that the Ukrainian is close to Polish, so it's easy to communicate. But also we had 2 million Ukrainians in Poland before the war. They were living and working here. So the patients and the refugees would like to stay in Poland, even though they have a chance to move to Western parts of Europe. So generally speaking, there are nearly 3 million of refugees in Poland. So from the statistics, it counts that they must be some PAD patients, and they are. And there are about 200 Ukrainians being hospitalized right now. Half of them are children. When it comes to Ukraine and the situation here, there are about 1,000 patients with PAD living there, but only 200 of them are in the have the replacement therapy. And there were some issues with immunoglobulin access in Ukraine. I was also helping them to solve it before the war. And of course, the war changed everything. The hospitals are being bombed, were bombed. The supply chains were stopped. So the patients with rare diseases, especially patients with PIDs, have to flee the war in order to get the continuity of treatment in other country, preferably in Poland, as you can see. So we are doing everything we can to aid them in the situation. I just have to say that this is disaster which is going on in Ukraine. I mean, the brutality of this war, the brutality of the aggression, taking civilian targets, hospitals for a target is something I still cannot believe it's happening in the 21st century in Europe. But this is the situation that we are being placed in, that we are facing, and we are doing everything we can as a team, but also as a nation, I believe, to aid those refugees. When it comes to our help, well, as I mentioned, we stopped our usual actions for the time of the war. I decided to do it. And to focus ourselves using our contacts with Ukrainians, with Polish physicians, with physicians in other EU countries, to start helping those patients who need it in Ukraine. What we do? First thing first, we are helping them flee the war. I mean, we are helping them to cross the border. We are helping them to cross the border with families, which is not obvious because men are not entitled to leave Ukraine. But if there is a need to do it, to have a carer, we are also doing everything we can on a legal basis to provide them with safe transfer via the border, if needed with a humanitarian corridor. I mean, the corridor that we are being organized with some kind of fast track for those patients. So we are moving them from Ukraine to Poland and then to specific hospitals in Poland. I will elaborate more on it in a while. The second thing is the on-site support for the Ukrainians, the state in Ukraine, and the third one is providing information, legal support for those patients seeking care in the European Union. When it comes to helping those patients flee the war, as I said, it's about helping them on every stage of their journey to Poland. I mean, even we got phone calls from, let's say, Kharkiv, which is on the front line, like the woman was saying that I am currently on the bus, somebody placed me on the bus with children, we are going to Poland, what to do? And I have no idea when we will be in Poland and where we will be in Poland, please tell me what to do. We received calls from people like, we fled the war, we are on the gas station in Warsaw, what should we do? And many other signals like this. And I mean, there are no procedures, we are just building the procedures and we are trying to scale the actions, but well, we haven't been prepared to such a situation. But we manage, I mean, we managed to help those people. Nobody that reached us was left without help. I mean, we helped everybody that asked us to do it. And we're also providing initial accommodation for the patient's family. We are taking care of the medical affairs, I mean, to provide them with all the needed paperwork in Poland, and then to set up an immediate visit to the immunologist, which is of course crucial in order to provide them with immunoglobulins in Poland. So we are doing everything to speed it up, everything to match the dates of the infusions that they got in Ukraine, that there will be no delay in Poland regarding providing them with immunoglobulins in Poland. Of course, we are also doing everything to secure more IGs to Poland. As Martine said, there is a global shortage, but we are also doing everything we can to in cooperation with, of course, industry and other stakeholders to provide as much immunoglobulin as possible to also secure the needs of Ukrainian patients, which are starting to be a significant part of the Polish PID patients community. Of course, we are also transferring them to other EU countries. It's often like there's somebody in Poland, but he decides or she decides to go further to other EU country or even outside the EU, like in the UK. So we are also contacting specific patient organizations or physicians to provide them with care there, and to do the paperwork in other EU countries. As you can see on the photos, there is Yegor, 11 years old, ex-Solek patients which received immunoglobulins in hospitals in Łódź, like 2 weeks after the family fled the war. We managed to help over 50 families so far, probably would reach 60 today. And number is still growing. There were a couple of waves of refugees. The biggest one was also in the beginning, but there was also a significant wave of refugees after reliving the war crimes that have been made by Russians in Bucha near Kiev. What is important, we also secured not only treatment with immunoglobulins, but we secured for bone marrow transplantations for patients with various types of immunodeficiencies to SCIDs, and also to liver transplantations for other patients with other rare diseases, namely Wilson disease. So this is also what we did to create a humanitarian corridor for them, to ensure them with a fast track, and to provide them with the possibility of having a transplantation in Poland, as the hospital where they were meant to have it was, of course, bombed. So they have even dates of those bone marrow transplants, liver transplants, but they just get the message that it's not possible, and so they need to do something. So we moved them to Poland. And there are various rare diseases that, people with various rare diseases that we help, but as you can see on the list, most of them is with various immune deficiencies. Of course, there is X-linked agammaglobulinemia, but also CVID and ALPS, and DiGeorge and Niemehan breakage syndrome. So this is not only about providing immunoglobulins, but also other kind of care like wheelchairs and so on, special accommodation for them. So all of those people require a very specialized approach. So I'm very happy that also I can kudos my volunteers, a team of volunteers, also volunteers that came from the Immunoproject, but also other volunteers, med students that helped us, and my wonderful team, which is also taking care of those cases. When it comes to statistics, as you could see in one of those slides before, most of the patients are children, and most of them chooses to stay in Poland. Those who reached us or were provided us, the physicians in Ukraine provided contacts to those patients, and they mostly stay in Poland, but in some cases we moved them to Germany, to Sweden, to Austria, and to the UK, and to Czech Republic, and provided them with care there. Germany has the most tough paperwork system regarding refugees, but maybe this is not a surprise. And it's kind of easy to get a treatment in Poland, but not in Germany. But we're also doing our best to provide them with care there, with cooperation with a German patient organization. So we are helping them here legally, to obtain the refugee status, to get some kind of internal numbers, which are available in Poland to get, and then to provide them with medical care, of course, with the primary care, but also the specialist, to get them to the right immunologist. We're also translating the medical records, which is very important these days. We got a team of engaged volunteers, medical translators, which are translating them from Ukrainian to English, but this is enough. It's not possible to get a translator from Ukrainian to Polish right now, which is not a surprise. But we are translating them into English, and this is okay. And this is also, this helps much those patients too. At least to have some further diagnostics in Poland. What we also did is to deliver medicines and mostly medical equipment to hospitals in Ukraine that they are treating patients. Please know that the western part of Ukraine now is very in charge of treating most of the patients from the east, so the needs are huge. The medicines that were stored in the east, they are closed in the hospital or being damaged. So we need to deliver aid to those hospitals which are in the west of Ukraine to treat those internal displaced persons. The patients which are the refugees, but internal refugees in Ukraine. They decided to stay in Ukraine, but in the western part. So we also need to provide them with medicines. We raised over $30,000 to this purpose, and we bought equipment worth over $30,000 so far, and forwarded to Ukraine. There was one truck full of medicines, some kind of smaller, also donations. Now we are working to provide an infusion pumps, mechanical infusion pumps, which are not needing to have a power supply, to all Ukrainian PAD patients that need it. They are suitable for both IVIG and subcutaneous IG as well. So this is what we do when it comes to medicines. It's not legal to provide medicines to Ukraine according to the law in Poland and the EU, but well, I cannot say more, but we are also, there are some medicines in Ukraine. And I have no idea how they appeared to be in Ukraine. And when it comes to, of course, we are in touch with Ukrainian patient organizations. We got great relations before the war, as they were attending our courses, online courses for patient advocates. Those, of course, free of charge courses, online courses for patient advocates. So we are also giving them grants for their own projects. But now, as we get great contacts, we are also in touch with them and provide care to those patients, and also provide some aid to the patients on site. When it comes to the on-site support, they have been delivered to several hospitals treating PAD patients in Ukraine. And now Kiev, the main hospital is Kiev, is somehow safer. So we are also working on a delivery to them. But those, as you can see, those hospitals are in the western part in Ukraine. So they are treating the internal refugees, and also we managed to deliver medicines to Poltava, which is currently on the front line. We also try to do our best to ensure the access to immunoglobulins. Unfortunately, it's not possible to transfer immunoglobulins through the border, but we are trying to do our best to buy them on site in Ukraine from their national fractionator, which is maybe whose products are not available worldwide. This is only IVIG, but it is something during the war, so we're also working on that. When it comes to providing support and legal help, we developed 2 websites. The first one is about rare diseases. It's just rare diseases in Ukrainian, written in a Latin script. And the second one is Immunodeficiency.pl. So as you can see, this is about immunodeficiency. And those websites contain legal information. It's very extensive Q&A regarding how to access treatment in Poland, where to find proper hospital when it comes to PIDs. And I know that there are patients who are just taking information from the site and going directly to the hospitals without our aid. So we are more than happy to have it. We also did a little media campaign, also in Ukrainian media in Poland, to promote it. So we are very proud that we have those websites with legal opinions, with contact information, with some kind of information regarding how to obtain medical care in Poland. Everything, of course, is in Ukrainian, so it's easy to understand for those who are in need. As I said, there are websites, and we also provided some legal opinions. We are lawyers. I and our main project manager is also a lawyer, so we created legal opinions. We got it translated. We got the opinion also of the Ukrainian lawyer who is a refugee in Katowice, in our town, and so we are helping regarding legal issues. And in the beginning of the war, it was like that. It was not sure if those patients are entitled to get immunoglobulins, well, but we are sure that they are. So we also did some advocacy work directly in the hospitals to provide them with care. If there was a problem, well, we are patient advocates, so we were strict and we did our best to provide them with the care. Now it's not a problem. Also, we are currently working on 2 leaflets. First one about the medical system in Poland from perspective of the rare disease patient. How to get to the right specialist, and also a dictionary. The 2-size dictionary for patients with PIDs directly. with 100 most important medical terms, but also with pronunciation, both in Polish and Ukrainian. So both sides can use this leaflet as a help in communication regarding their disease. We also cooperate with other entities. There is a photo from a meeting that took place the day before yesterday in Warsaw, EURORDIS. I mean, we are very glad that we can cooperate with EURORDIS on those matters. We got a meeting with member of the European Parliament. We have contacts with the European Medicines Agency regarding shortages of IGs. So we're doing our best to create a working environment for those who are in Poland. I mean, both to secure funding to the Polish healthcare system from the other European partners, but also to secure the continuity of treatment for patients from Ukraine. As I said, there was a meeting the day before yesterday. The flag came from Kiev, from the direct war zone to Poland with refugees, with Tatiana Zamorska, who is the head of the Ukrainian Rare Disease Organization. And we had a meeting with EURORDIS, with Red Cross, regarding the situation in Ukraine. So we are cooperating with partners. I'm also glad to see our remarks in the letter that have been addressed to Ursula von der Leyen, the head of the European Commission. So we are doing our best also on the higher level. I mean, not on the ground level, but also on the level of politics, of direct advocacy work. Well, the best how to depict the situation is a human story, and let's meet Emily. Emily is a patient with severe combined immunodeficiency, and she has a donor and the date of bone marrow transplant in Kiev. It was like couple of days after the war started. So they bombed the hospital and they learned that there would be no bone marrow transplant in Ukraine. So they decided to flee Poland. They contacted us, of course, via the patient organization, and we provided them with everything. It was the third day after the invasion, so there were totally no procedures, and we managed to have a free space for bone marrow transplant in less than 24 hours before they called us in the hospital in Bydgoszcz in central Poland. So we are proud of it, but we are very happy to see Emily, that she's doing well in Poland right now. She's waiting for the date of the BMT. Of course, the date of the BMT is already being set. There is a donor, and we keep our finger crossed for Emily and her family. Also happy that her family is settled in Poland. I mean, her father found a job in Poland in his profession. He's a carpenter. They are well provided with everything they need in the place that they are. And we keep our finger crossed for the successful BMT, and that Emily will be cured from the severe combined immune deficiency shortly. Of course, there were some media appearances, both in the European media, US-based media like National Journal, and also in Polish media. We also received many thanks for the patients, which is a real fuel for us for further actions. Of course, our help is free of charge, completely free of charge, and this is what I would like to underline. We are doing it as volunteers right now. We are just counting on others people's generosity to make the foundation work, but our help is free of charge of the patients. No matter if it's a legal help with accommodation, shelter, everything is free of charge. They are in need. They have bombs in their country. They have war crimes in their country. So we have to help them as patient advocates, and I believe also as human beings. We also receive help from the patients that we help, I mean, from the hospitals that we helped, that we provide them with humanitarian aid. So we are very happy to see that the medical equipment is working for those patients in need. And those people are the real heroes. I mean, there is a common Ukrainian saying that they are saying that Slava Ukraini, Slava Herojom Slava. It means glory to Ukraine, glory to heroes. And when it comes to heroes, I believe that heroes are the Ukrainian physicians who stayed in the country, and they are currently treating patients that they needed desperately. So those people are the real heroes of the war for us. Also received many various thanks also from the hospitals. I mean, we got it today, and we're really moved in the office when we read it. And this is the fuel for us as well. We cooperate with a couple of donors right now. I'm happy that the industry also saw the necessity of helping us. I would like to say kudos to CSL Behring for providing us grant for, of course, directly just for medical equipment, but in the first days of the war, and this really helped us to start delivering medical equipment to Ukraine. Of course, we cooperate with other organization, non-profit ones like REUPLOAD, like the Ukrainian patient organization, but also, of course, we are in touch with my colleagues from the PES organization, I mean, from Immunodeficiencies, as we are friends, of course, without any issues. So we are also in touch with them, and we are helping as much as we can, and we will do it as long as will be needed. I mean, I'll be more than happy to be back in the business as usual after the war stops. But now our help is desperately needed, and we know it, and we are doing everything we can to support those people. When it comes to us, I mean, it was described before. I would like to say also thanks to my wife, Bernadetta, which is a vice president of the foundation and also CEO founder. And we are, as a whole, as a team, doing our best to provide those patients with care. Of course, I would like to ask you for any kind of support you might provide for the patients here. We are working on the donation page. Probably it will be ready next week, but it won't be possible without the great chain of goodwill. I mean, it's impossible how it's all possible. Sorry for this wording, but I can't believe how many people are involved in such actions, how many volunteers are involved in actions from various countries all over the world. You've got medical translators in the NY, in Washington, we got medical translators in the UK, we've got volunteers from various countries. I mean, this is something real big. Yesterday, I got a meeting with people from Singapore that were trying to help us. So this is really something that we feel the support of the world. We feel support of Canadian organization as well. I'm very grateful for the invitation that I can share what is the situation currently here. So we are very grateful. Like I say, that the patients are also really, really grateful. And when they say thank you to us, be aware that also they are thanking you for all the support that they got, even in words, but also in some kind of financial measures or any other kind of donations to them. And well, I will be in service as long as will be needed, will be in service as long as will be needed. So I am really happy that I could share this with you, and I keep my fingers crossed for peace, because this is the final solution of this whole mess. So thank you for being with me. Thank you for attention, and I'm ready to answer those any questions that would come from you. Thank you.
Thanks, Adrian. I am going to stop sharing my screen. Thank you so much. Unfortunately, we don't have time for questions today. We had such wonderful presentations from our speakers. If anyone has any questions for our speakers, please email us at info@cipo.ca, and we will pass them over to Adrian and Martine and get those answered. I have some questions that I'm going to send them and get answered, and we will post them up on our website along with the video of this webinar, and that will be posted up on our website and on our YouTube channel. I would also like to say that this week for World PI Week, April 22nd to 29th, any donations that we receive here at CIPO, we are donating 50% of all of our donations this week to go to the efforts of organizations like Adrian's, as well as 2 other organizations working to ensure access for Ukrainian patients for PI. So you can see more details of that on our website, including which organizations those are. We appreciate everything that Adrian's organization is doing, as well as IPOPI. We've been working, Martine kind of said a little bit about what we're doing. We've been working with Dr. Bruce Ritchie's clinic in Edmonton, Alberta, to try and make it easier in case any patients need to come to Canada from the Ukraine. We have a process in place and it's done and ready. So I'd like to thank Martine as well for helping us to get that process in place. I'd like to thank everyone for joining us today. As I said, this would be available on our YouTube channel, hopefully by the end of the day. And we'll be sending out that link, and it will be also on our website. So thanks again to Adrian and to Martine and everyone for joining us. Don't forget, we have our walk for PI tomorrow and Sunday. So hopefully everyone will get up and walk with us, and we'll see you soon. Happy World PI Week, everyone. Thank you very much.
Thank you, and good walk.
Thank you.